We're Synapse, and we've revolutionised Australian medical billing. Doctors can now send their claims from the palm of their hand to Medicare and the other payers using an app.
But this is much more than an app. This is decades of experience. We understand the challenges in health financing transactions and have been able to rethink and redesign the medical billing process from the ground up.
There's a lot of mistrust between doctors, payers and patients around medical bills. But most patients and doctors are just trying to navigate the health system as best they can, and most payers actually want to pay. They just want to be sure they're paying for the right things. So we embarked on a journey to restore trust to this sector, and we found that there were 4 problems we needed to address.
First, patients. Health transactions have what academics call information asymmetry, which is just a fancy way of saying doctors know more about our health than we do. But this makes them very different. In health transactions, we don't purchase the characteristics of what we buy. Let's face it, having a colonoscopy is not pleasant. Who would choose to buy that? And we don't have equal bargaining power. When we buy a car or have our house painted, we know exactly what we want and we can do something about it if it's not the way we want it. But in health, we buy the promise of an outcome, an improvement in our health. But the problem is, we don't know if what we're being sold will provide the outcome. So we have to trust our doctors, not only to provide the most appropriate care, but also to itemise that care correctly on our medical bills.
We also want our bills processed quickly, tap and go, just like every other aspect of our lives.
Second, payers. When you tap your credit card, you're spending your money. It's a simple transaction between you and the seller. But in health, there's a minimum of 3 parties to every transaction, and you're spending the money of a party who isn't present. Bankers call transactions like this card not present and charge more to process them because they're classified as high risk. So because the payer is never present in health transactions, every transaction is high risk for the payer, who's usually a government or private insurer.
Third, doctors who didn't do medicine to become medical billing experts, but they're still legally responsible for every claim. They don't learn about the Medicare system during their training, and the tens of thousands of medical billing rules are not available in a single resource anywhere. So there's nowhere for doctors to learn how medical billing really works, even if they have the time.
And fourth is the system. Doctors can enter any combination of item numbers, right or wrong, into every medical billing program in Australia. They're all the same because the Medicare online integration process is the same for every software vendor. This leads to mistakes and incorrect claims that are rejected, and that leads to adjustments, manual processes, resubmissions and delays. When payers see these incorrect claims hitting their systems, they may think that doctors are deliberately billing incorrectly, even when they're not. And so the vicious cycle that erodes trust continues.
So, you've got a system where doctors are legally responsible for their billing, which they're never taught, and can be prosecuted if they get it wrong. There's tens of thousands of rules that are not available to view in any single place. Patients don't know what they're buying, but they still want medical bills processed at tap and go speed. And payers are expected to pay millions of high-risk transactions that have all been sent to them through software products that facilitate incorrect claiming. How do you fix all of that?
Well, you start by stopping incorrect claims before they go to payers. We did this by building the first medical billing rules engine in Australia and putting it in the Synapse app. This means more correct claims arrive at the payer end and are more likely to be paid. So a virtuous cycle begins, which benefits everyone.
Then there's the behind-the-scenes Synapse Army. This rules committee comprises the most qualified medical billing team in Australia and meets fortnightly to review rules and add them into the next release. And we even have a team constantly monitoring fee schedules across the country and updating them in our system. So you don't have to worry about whether the latest fees are being applied. They are.
Doctors have traditionally been charged for medical billing services as a percentage of their earnings. Well, that is a thing of the past. By replacing paper with technology, we've been able to keep our prices unbelievably low.
Like all the best ideas, the Synapps MBS came about as the answer to an unmet need. I managed medical billing for decades and the stumbling blocks were obvious from the start. I kept hoping someone else would invent a solution that I could use, but no one did, so I decided to tackle it myself. What unites us at Synapse is that we genuinely care about the delivery of health. The service provided by doctors and other medical professionals in Australia is second to none, but they and the payers in the system have been let down by a labyrinthine billing process. We've worked hard to change that, and we're really proud to have made a genuine breakthrough, creating a payment system that makes a real difference for patients, payers and doctors.